Hi, I'm Charlie Merrill with Merrill Performance. I want to talk today about a very common pattern that I see with lower extremity injuries. These are leg injuries like hip pain, knee pain, ankle and foot pain that I see every day in my clinic, especially in endurance athletes. And I saw a runner this week who is a new collegiate runner from California, home visiting for the holidays. And she'd been struggling with some long-standing IT band, quad, and knee problems that were really preventing her from training in her first season as a collegiate runner. And she'd seen a number of excellent clinicians who had given her great advice on how to strengthen her hips, how to release tension around her hips and knees, but no one had yet taken a look at her low back. And it's really important to know that the low back almost always plays into lower extremity problems. The way I explain this to people is that the low back is the source for all of the nerve input to the extremities. The lower lumbar spine, that's L4-5-S1, tends to give power, muscle power, and sensation to the back of the body, the glutes, the hamstrings, calves, and feet. And the upper mid lumbar spine, L2-3-4, tends to give information, power, sensation to the front of the body, the hip flexor, quads, and knees. And when a person that's struggling with a lower extremity injury is not addressing the low back, they're missing a really important part of the puzzle. So you can see in this image that this athlete has a very clear strip of discoloration across her lumbar spine where there's some blotchiness, the skin's a little darker. If I overlay the segmental levels, you see L1, 2, 3, 4, 5 from high to low, down to S1, which is the tailbone, the first part of the sacrum. And then if I sort of define this strip of discoloration, you can see that it falls between L2, 3, 4, and maybe even encompassing L5 a little bit. The skin above and below that looks normal, the skin through this area not so much. And the superficial discoloration is just a sign that the underlying tissue maybe is not so healthy. In the case of this runner, her fascia and muscle density and the amount of hypertone tension she had in this part of her body was really pretty severe, even though she already worked through a lot of the other issues that were causing her IT band and knee pain. So I spent the last couple weeks while she was here visiting treating her low back using needles, as you saw in the picture, but as well giving her strategies on how she could work on the fascia and tenderize and improve blood flow to this part of her body. So the RAD roller is, the RAD Helix is a tool that I use a lot to empower people to get into these areas and tenderize them and soften them up and improve the muscle health, which eventually changes the skin quality and the color, and the whole area tends to be healthier then. So I'm going to show you how you can use this at home to treat this yourself. So the RAD roller is meant to be used really anywhere down along your spine, but I find it particularly excellent for the low back. I'm going to start it right down in the lowest part of my low back, just above my tailbone where there's a lot of sort of soft tissue, and just lie down on this thing, let it sink in, take some deep breaths, and just explore around either by rolling up or down where you feel like there's some tenderness. I like to let my legs roll side to side depending on which side feels the most tender. Generally, if you have pain in your right side, you're going to have maybe more tension in your right side. If I have problems in the back of my body, I'm going to tend to focus the roller a little lower in that L4-5-S1 segment. If I'm having problems in the front of my body down to my knees, I'm going to roll a little higher, be up in that L1, 2, 3, 4 part of my lumbar spine. And yeah, just working on going back and forth to bring blood flow. You can do things like bring the knees up to the chest and roll side to side to open things up and increase the pressure. You can lift your head, which will press your back into the roller a little more and increase the pressure that way. Sometimes I can cock my hips side to side to close one side and open the other. Again, this is all aimed at softening up tissue, decreasing fascial density, and improving blood flow to the area. You can find these online, RAD roller. This is the Helix, and give it a try. Let me know what you think. Thanks for tuning in.